Great. So welcome everyone, and welcome to Connecting the Dots with Dr. Ashaye. I'm Lola Ashaye. I'm a primary care physician and owner of In Touch Primary Care in Sugar Land, Texas. I am so excited you're here with us today. This is the place to be if you desire to or you're motivated to take charge of your health and make sure that you can live a healthy lifestyle. So if you have back pain or you know someone that has back pain, today's episode is for you. I have a special guest, a specialist in this field, Dr. Malini Khanna, a physical medicine and rehabilitation and spine specialist. And we're going to be discussing practical tips to reduce symptoms from and prevent lower back pain. Welcome, Dr. Khanna.
Thank you. Happy to be here.
Yeah, thank you for being here. And before we get started, just wanted to remind you that this episode, as with all our episodes, are recorded and available on the In Touch Primary Care YouTube channel. So you can subscribe to our YouTube channel and share with anyone you think may benefit. All right, so let's get started. So I'm going to start with asking you, Dr. Khanna, to go ahead and introduce yourself and share what you would like people to know about you personally and professionally.
Sure. My name is Malini Khanna. I'm a PM&R physician. So like you said, physical medicine and rehab. I specialize in lower back pain and sports medicine. I'm located in Philadelphia, Pennsylvania. And I just recently opened up my own practice called Concierge Spine and Sports Medicine.
That's awesome. That's awesome. And you're a PM&R and spine specialist. Can you explain a little bit more about what you do, what kinds of patients you see?
Yes, so PM&R is it's also known as physiatry. So it's a little bit of it's a field that is not so mainstream yet, but it is a very important field. So what we do is we look at the whole body, the whole system, the whole kinetic chain. I tend to focus on lower back pain. I provide patients with a full evaluation, go through exercises of what they can do. And then I also perform the lumbar spine injections, the epidurals, facet blocks, SI joints, and radiofrequency ablations to help aid in reducing the pain so that they can live a healthy lifestyle.
Oh, that's awesome. So many different ways to treat, different conditions depending on what they have. That's great. So what are some common conditions you treat in your patient population, and how do you go about treating them?
So the main thing, like the lower back is very, very common. So people come in, they can have pain across the back, or they can have pain shooting down their legs. So generally, if you have pain radiating down your leg, you would try medications first. If that didn't work, then we'd send you to physical therapy. If that didn't work, then I would see you back and try an epidural. So epidurals generally help with pain going down your leg. Similar for the pain across your back, we would first try medications, then physical therapy. And then the difference is usually I would offer a facet joint block, and that would help target the joints in your spine. So every time you get a spine injection, it's not always an epidural. And that's kind of something that people always think, oh, I had a spine injection, it's an epidural. It's actually not. I try to target the medicine in the appropriate area. And then one other common area is your SI joint, your sacroiliac joint, that can cause back pain. That's pain in the lower back radiating into your hip. And that is a joint that lives right behind your hip. And I can also inject that to calm down inflammation. I also treat a lot of sports medicine type things. I do like to see chronic tendon issues, but today we'll just focus on more lower back pain.
Awesome. Yeah. So it sounds like there are many different ways to treat pain and to be more targeted so that you're not just generally when you're targeting where the pain is coming from, it's so much more effective. So that's really awesome. All right. So can you give us 3 practical examples about how people can reduce symptoms from or prevent lower back pain starting now? Like what can they do right now if they wanted to reduce the symptoms or prevent pain?
Yeah, for lower back pain, it all comes down to stretching. as we age, we become stiffer. And that is what, there's a way to counteract the stiffness, and that is to stretch. So the main exercise I recommend is the cat and cow. So I don't know if you've ever seen like where you get in the cat position and then you get into the cow position and you arch your back and then you release it. So you get down all on your fours like a dog, and then you kind of arch your back and then you round it. So I'm trying to do it in the chair here, but it just kind of opens up the joints in your spine. And you do this 10 times a day. You know, you can, if you have time during the day, it's best to do. But definitely when you wake up, right before you go to sleep, when you're sitting watching TV. I know we don't really have commercials anymore, but just try to time it. You would used to tell people watch it during your commercial break to do your stretches. So cat and cow is really important to do. Just it opens up all the joints and just stretches out your back. The second thing that I recommend is press ups. Now, this is also something you should get down on the floor to do, and you're flat on your stomach, and then you lift your arms and straighten your arms up and you arch your back. And that again opens up the spine in a different way, because we're always looking down and doing work on the computer, looking at our phone. So this is the opposite. We're going to press up and look up, and then you kind of almost do push-ups. So the press ups kind of help again with the flexibility of your spine. And then the third thing is core exercises. You do have to have a strong core because it's all connected. So one of the exercises that I recommend for core is to just sit against a wall and pretend like you're sitting in a chair. And you can feel it immediately. Your core will contract and you'll probably fall over. But if you try it for 10 seconds, then the next day do it for 15, and then the next day do it for 20, you'll build a stronger core, and over time you will get stronger, and then that takes stress off your spine into your stomach, and you don't have as much stiffness and pain day after day. So I would try these just fun little exercises. You can get the kids involved, and you can have little competitions to see who can hold the chair position the longest, or who can do cat and cow without falling over. So that's what we do at home.
Oh, wow. Those are that's awesome. Okay, let's pause here. I mean, these are really, really simple things that many people can do. Obviously, if you have health conditions that prevent you from doing this, you want to definitely check with your doctor. But many of us can do these really simple things starting now. So if you're listening, I want you to pause and make a commitment right now. Pick one, just pick one. Okay, that you're going to start doing consistently starting today. So do you want to start? We want to all stretch, right? So we can do the cat and cow as she described. We can do press ups, or we can strengthen our core. So let's pick something. I'm going to pick strengthening my core. And if you're already exercising, you can incorporate this into your exercise routine. So before my walks now, I'm just going to do that first and then go from there. So I hope you guys chose one thing, and you can add in the comments when you join us on YouTube what you chose to do, and we'll go from there. All right, so help us connect the dots, Dr. Khanna. Do you think there is an advantage when patients consistently follow up with you instead of going to different places for care? And can you give an example?
Yeah, absolutely. It is very important to have kind of the consistent voice for these patients. So my model in my new practice is that I want to have patients work with me on their mindset, kind of lifestyle things, mindset about how they can exercise, how they can get out of pain. And then I want them to work with me on movement, like we discussed, the exercises, and then also on nutrition to help, them just basic healthy eating. So if I can provide that service to the patients and actually spend some time with them going over these very necessary things for a healthy lifestyle, then they will need less follow-up. They'll probably need less specialists. Right. So I really think that I mean, one practice or even like a physician that can spend time with you and really kind of follow you through your journey is very important. Because a lot of times we get lost in the system, go see a nutritionist, go see a physical therapist, go see orthopedic surgeon. It's just sometimes the patients get lost through the cracks. So I really think it's great to have follow up with your patients.
Yes, absolutely. Yeah, I agree. I think just making sure somebody is taking that time to take it all, put everything together and make sure that nothing is slipping through the cracks is so important. Awesome. So let's get into your concierge practice. Why did you decide to go this route, and how is it different from, other insurance-based practices or other practices in general?
Yeah, so I've been practicing in the traditional insurance model for almost 10 years. In the last few years, as I'm sure you know as well, the regulations have just been out of control. They're, dropping reimbursements, they're increasing authorizations for every little thing. I was doing so many peer-to-peers. I just felt like I wasn't treating the patient at all. I was really treating the insurance. I was going through their, packets of what they wanted us to do. So, okay, we got to try this medication. That fails, we got to try the next medication. I'm like, I'm losing myself as a doctor in this traditional insurance model. So I just got really frustrated. I decided to break off and start my own practice, and I wanted to bring back patient care essentially. So I'm starting a more of a direct care model where I can treat you. I do accept a few insurances because that's the reality, is that a lot of patients don't know about this new model. So just to get my practice off the ground and to just kind of, encourage people to see the new model, I am accepting a few insurances. But essentially the whole point is that I will be able to see you. I won't have to worry about what box I have to check off according to your insurance. I wouldn't have to worry about waiting for an authorization. If you're in pain and you need an epidural, I will try to do it same day, next day, to help you not go to the urgent care, to help you prevent you from going to the emergency room, just kind of taking away the lack of care that we're missing. Is that because the insurances are just kind of telling us how to do medicine right now. So I'm trying to take away the middleman and hopefully be able to just provide better care. And I know your practice is very similar.
Yes, it is. It is. And can you tell me, is there anything you would like to know about how we practice?
Yeah. So if you could explain just how you find patients, how you talk, like how the membership model works, that would be interesting.
Sure, sure. So like you said, I have a direct care practice as well. And I've shared many of the same frustrations that you expressed. But direct care is so different. It's more personal, but many people don't know, they're not aware of it. And most of them assume that if they have insurance, they cannot benefit from this model of care. But what I've tried to do is I try to discuss this wonderful model with as many people as possible. So I find opportunities to connect with other business owners. And my patients, once they've experienced it, they talk to their family, their friends. So most of my patients come from word of mouth. Then I've also tried to make myself as visible as possible online so that people can find me easily when they're searching for primary care doctor on Google. I mean, they'll go to our website, they'll go to Google and look at our reviews, they'll go to health grades, they see how our patients love it. And many of them will call based on the reviews as well. And then I've been listed on several direct care websites. So those that are already familiar with how direct primary care works, they can easily find me that way too. And when people experience the difference really, and they enjoy all the benefits that we offer, they tend to stay on. So it's just, it's really trying to educate people that there is a better way out there to take care of yourself, and you can, more convenient, easily accessible, way that is not restrained. We're not restrained by rules and regulations of insurance. So it's just trying to get the word out there as much as possible. Yeah.
Okay.
Did that answer your questions?
Absolutely. Yeah.
Right. Awesome. So do you have any parting words, just any advice for our listeners before we round up today?
Yeah, just treating low back pain for the past 10 years. The best advice I can give you for your lower back is to stretch, stretch, stretch. 10 minutes a day, take time, stretch what you like. I do recommend yoga if you like it. If you don't, you can do some yoga moves. And that's kind of how I do things, is that I pick the yoga moves I like and feel good, and I just kind of stick with those, and then I add on to it. So stretching is the key, and then also variety. You don't want to do the same thing every day. If you stretch the exact same way every day, or you don't go into a deeper stretch, then your body will get accustomed to whatever you do. So variety and stretching would be my best parting words for lower back pain.
Awesome. Okay, so that means I'm going to modify my commitment. I'm going to do one of each every month. Okay.
Love it. I love it.
All right. So, and how can people find you?
Sure. So I have a website. It's www.cssmpa.com. I'm based in Philadelphia. So if anybody is in and around the Philadelphia area, I'm happy to take a look at you. I also do have TikTok, Instagram, and Facebook, and that's at Concierge Spine and Sports. And then I also do have a few videos on YouTube, and that's my first and last name, Malini Khanna, MD.
Awesome. Thank you so much, Dr. Khanna. It was a pleasure having you today. Thank you, listeners. Thank you for joining us. That's all we have this week. Please remember your commitment, stretch. You can do push-ups, you can do core muscles, you can do cat and cow, whatever it is. It's important to stretch those back muscles. And you can join us here every week on Wednesday at 2:15 p.m. Facebook Live, or watch it on our YouTube channel. Remember to subscribe and share with someone who needs it. All right. Have a great day. Bye-bye.
Bye. Thank you. It was a pleasure.
Bye.